Hi friends, let's have a short discussion on the management of breast cancer. The first thing to be done after confirming the diagnosis of a breast cancer is to stage the disease. This staging is done by clinical staging to be confirmed by various radiological tests. And why do we do the staging? The aim of the staging is to divide the disease into early stage and late stage. Early stage, we can cure this patient, while late stage, our intent of treatment is just the palliative management. So breast cancer can be divided into early stage breast cancer, locally advanced breast cancer, and metastatic breast cancer. So coming to the early stage breast cancer, here the survival rate is high and most of the patients are being offered surgery, and the surgery mostly for performed is the modified radical mastectomy, in which breast along with the nipple areola complex along with level 1 and level 2 axillary lymph nodes are being removed. After the surgery has been done, almost all the patients are being given chemotherapy. The indication of chemotherapy is tumor should be 1 centimeter or any lymph node is positive or the tumor is having aggressive pathology. So almost all of the patients are having these features, so they get the chemotherapy. There are various regimes of chemotherapy. The most commonly regime which was used was CMF therapy, cyclophosphamide, methotrexate and 5-fluorouracil, which was replaced by CAF, that was cyclophosphamide, adriamycin, like doxorubicin and 5-fluorouracil. Nowadays, at most of the good centers, the regime being followed is cyclophosphamide, adriamycin, and one of the taxanes like paclitaxel. So most of the patients are being given chemotherapy. In some of the patients, in the histopathological reports, if four or more lymph nodes are positive, or if it is found to be stage 3 disease, they are also being given localized radiation, or that is known as radiotherapy. In those patients who are having estrogen receptor positive, progesterone receptor positive, they are also given hormonal therapy in the form of tamoxifen at least for 5 years. Those patients who are having HER2 new receptor positive are also being given trastuzumab in the postoperative period. Now, in the early stage breast cancer, there is another surgery which is very commonly being performed at good centers, and especially those who are cosmetically sensitive, and that is known as breast conserving surgery. So what is breast conserving surgery? In the breast conserving surgery, the whole of the breast is not removed. In fact, most of the time it is just the tumor along with a rim of normal tissue, like one centimeter of the normal tissue may be removed, or sometimes even one quadrant can be removed. Now, there are some basic indications of breast conserving surgery is that the patient should be fit enough to receive radiation therapy. All the patients who undergo breast conserving surgery always get radiation therapy. So all those patients who are having contraindications to radiation therapy, like previously having a huge dose of radiation in the childhood to the chest region, having severe pulmonary issues, or the patient is having pregnancy, they are not candidate for breast conserving surgery. So all the patients are supposed to get radiation therapy. And just like the other regimes, the patient gets the chemotherapy, the patient gets hormonal therapy in the postoperative period. Now coming to the locally advanced breast cancer. Locally advanced breast cancer word is used when the breast cancer is advanced regional and the locally. Like if it may be fixed to the pectoralis, it may be fixed to the chest skins. The patient may have big axillary lymph nodes or big supraclavicular lymph nodes. All these patients are treated as locally advanced breast cancer. And these patients are, the modality of the treatment is multimodality treatment. Multimodality treatment means the patient is given chemotherapy before doing the surgery, and that is known as neoadjuvant chemotherapy. After giving few cycles of chemotherapy, then the patient is taken for surgery. Most of the time it is modified radical mastectomy. Then patient is also given few other cycles of chemotherapy. Then patient is given radiotherapy as well as hormonal therapy depending on the hormonal status. Now coming to the metastatic cancer. Here our intent is just the palliative management, because the disease is too advanced and it's not going to increase the survival rate. Just we want to improve the quality of the life. So depending on the metastasis, whether it is in bone, whether it is brain, or whether it is lungs, our management is that wise. Sometimes it is just main management, sometimes it is management of pleural effusion, sometimes systemic chemotherapy and hormonal therapy is given. In the form of surgery, there is one surgery which is sometimes used as palliative management in advanced malignancy, and that is known as toilet mastectomy in case of pain, in case of bleeding, in case of infection of these cancers, and that is just simply remove the breast tissue, also known as simple mastectomy, or we can call it toilet mastectomy. And this is all in short about management of breast cancer. Thank you.